is Cheryl Kelly, and I'd like to share with you some information about a treatment that was successful for me. A little bit of background. I basically would say that I struggled with stress and anxiety and panic disorders probably from the day I was born. Even as a small child, I can remember being called worrywart and, why are you so anxious and things like that. So I struggled most of my life with that. I'm 64 years old. Over the past maybe 30 years, I did need to be treated with medication for depression, anxiety, and stress disorder. And that was always successful. It was effective for me. It turned around with the disorder. But of course, as most people know, that carries a lot of side effects, which can be unpleasant. Sexual side effects, appetite, kind of a numbing sensation, things like that. But it did take care of my anxiety and depression. About 8 years ago, I started extensively taking care of my parents who were dying. And at the end of that stint, I also developed a disease which I needed to see Dr. Chaudhry for. He is a rheumatologist. And after my mom passed away, I had been seeing him, and I came in and told him that I was at a brick wall. I couldn't function, I couldn't think straight, I couldn't make decisions, I could not sleep, I could not, although I was very, very fatigued. So all the general symptoms of a severe depressive disorder that needed something done right away. And in the past, I would have sought medication, and he so kindly suggested that I was a good candidate for this device, which he explained would calm down my nervous system and kind of reprogram or restructure, I guess is maybe the words I would use, the chemistry. And this was a device, and at that point I was perfectly happy to try anything. No medication, zero side effects. The device is put on the outside of the ear with little electrodes, and you wear the device for about 7 days. It's painless. You don't feel any sensation, except you feel good. You feel better very quickly. I did anyways. I imagine it might be different for other people, but I felt within, I would say 2 to 3 days, I felt much better. I could think clear, I could make decisions. Things didn't seem so out of proportion. Even though there still is sadness in life, it worked out. Things made sense. I could cope, I could work things through. And moving forward, you wear the device. He sets up a protocol, Dr. Chaudhry sets up a protocol. I guess it's different for everybody. Typically, he mentioned that usually you wear the device for about 7 days, and you come in every week for the first maybe 4 weeks to have this device changed. The battery only lasts so long, and the electrodes, need to be changed. And it's funny because at the end of the first week, I picked at it and it's movable, so it came off. So it was on for about 4 or 5 days, 5 days. And by the time I got in here on the 7th day, I started to feel anxious, agitated, and stress. A lot of the symptoms that I had, not nearly as bad, but a lot of the symptoms that I had right before I was treated. And that concerned me, and he said, no, that's perfectly normal. The device is off. You still need the therapy, you still need the treatment. So sure enough, he put the second application on, and within a day I was, feeling quite good again and very happy. Like I said, no side effects, no, nothing to worry about. And this was for 4 weeks, and then he weans down based on your symptoms and how you're feeling. He's very respectful of you as a person, very non-judgmental. You don't have to, pour out all your past or anything. He's treating the symptoms, and he's treating you as a person. So it's been a wonderful experience, and it's something you can do for life if you want to. From my understanding, you may need a little tune-up, as he calls it. but I'm very happy. And I almost relate how I was feeling to a post-traumatic stress syndrome. When someone's like this their whole life, and then they might have several years of repeated stressors, I would imagine that it felt to me like someone that was, in the war or in stress constantly, that it feels like post-traumatic stress syndrome, and it was successful in treating me. So my hope is that it is successful in treating other people that are in need. Some of our vets, people with chronic pain, I can see it working in a lot of applications. So I'm very happy.